am Dr. Susan Harmon. I have a specialty in general internal medicine, though I'm retired because I am disabled. I am now the contracted clinical director for COINS in Oklahoma City. I've looked at medical care from both sides now because I've been a physician for a long time. I graduated in 1985 and I saw the disparities in healthcare from the time I was a third-year medical student until I quit practice. But I've also been very ill the past 10 years, almost 12 years now, and so I've seen it from that aspect too. And I had to retire because of my health in December of 2004, and I was very ill the first 2 years that I was retired and disabled, but I have improved somewhat in my health, and I decided with the energy that I have left after I take care of myself and my husband each day, I was going to spend it on helping people get access to health care. I wouldn't be here if I didn't have access to health care. I did have insurance at the time that I was diagnosed with my illness, which was lucky because if I didn't, I would never have been able to get it. And when I left work, I was scared to death I wouldn't be covered, but luckily I was married and so I could get health insurance through my husband. If I wasn't married, I would have lost my health insurance within 18 months after stopping my job. And when you apply and get Social Security disability, which I did get, you don't get health insurance for 2 years after you get disability. So actually what happens is your COBRA insurance runs out before you can ever be eligible for Medicare. And I don't understand why it works that way, but it does. Luckily, I didn't fall in that crack. I was able to get onto my husband's health insurance. The big problem for us came, first of all, with the co-pays. The co-pays for health insurance include a $500 deductible and then a $2,800 co-insurance per year per person, plus co-payments for medications, and that ran usually about $500 to $600 a month for me. Plus, my health care premium was $554 a month. Plus, I had to pay co-pays every time I saw a physician. So in spite of the fact that I had health insurance, I always spent about $30,000 a year on health care expenses, including my health insurance premium. So that even if you have a good income, it is a huge bite out of your income just to get the health care. In 2006, I was very ill, and I was getting sicker and sicker, and my physicians here were stuck. And they recommended I go up to Mayo Clinic. And Mayo Clinic was out of network for my health insurance. And I went up there and got an extensive evaluation, but I also got complications from the treatment that they gave me there. So in the long run, my bill from Mayo Clinic was $22,000, but because they were out of network, I had to pay $13,000 of the $22,000. And in spite of the fact that I'm a retired physician and my husband is a full-time professor at Oklahoma State University, it took us well over a year to pay off that debt.